you have to stop and think. We're seeing so many weird things. The patient I saw today was a 16-year-old already with an autoimmune condition diagnosed at 13. I'm hearing more and more and seeing quite a bit in my practice, and you kind of have to ask yourself, where is this coming from? And I think that's a huge component. It is environmental toxins. Think about all of the products you use on your skin. Even consider perhaps moving away from a deodorant containing aluminum. Consider cleaning up the toothpaste products. There's so many things that we can do to decrease the toxic burden on our bodies. Hey everybody, I'm Lucy Douglas. I'm a family nurse practitioner and owner and CEO of New Beginnings Wellness Center and Spa in Ruston, Louisiana. October is Breast Cancer Awareness Month. So I want to talk today about this subject, and I'm doing so in memory of friends of mine that did not win their battle with breast cancer, and in honor of a dear friend that I have now who's waging war. And then also in honor of women that I currently take care of that are survivors. And so, as per usual, I always want to talk to you from a perspective of prevention and talking to you about and asking the question, are there things that we can do in general to reduce our risk of disease, and certainly what can we do to reduce our risk of cancer? But this month, I want to focus on women and reducing our risk for breast cancer. So some of these things might not be particularly earth-shattering. You'll be like, yeah, I already knew that. Or, Lucy, you say that, but I know friends that don't fit that, and yet they still got cancer. Well, I still would say there are always the statistical outliers, and we know that cancer is a complex systemic disease. And so we can't say with 100% certainty that any of these interventions would protect all of us all the time. But I still think we always need to have the mindset of being optimal, of being limitless, and striving for that youthful, vibrant longevity. And so this discussion today, for me, just fits in to that paradigm. So let's talk about prevention, and let's talk about what some studies have shown us and what some of the research is, with very valid information saying to us these are things that we should be implementing. So one thing that has been shown in multiple studies is that to reduce our risk of breast cancer, we should limit our alcohol intake. And I know that might make everybody kind of hang their head because, we might think that glass of red wine at the end of the day is, kind of a thing we look forward to. We're just sitting outside on a pretty evening with our spouse or loved ones or a group of girlfriends and just kind of having a conversation around a glass of wine. That seems like something very innocent and really a nice way to end a day or a work day or a week. But the studies are pretty, I won't say conclusive, but certainly are giving us a really good indication that right now it has been shown that there's really not a safe amount of alcohol to consume. In the past, we've been told women should have no more than so many ounces a day and men should have no more than this much. But really, more recent studies are saying they really can't quantify that. They can't tell us that it's really okay for us to drink alcohol on a regular basis. So if you're one that's having 2 to 3 glasses of wine regularly, almost every night, then this is an area certainly that you could do better in and reduce consumption. One thing that I suggest to women is that if you are wanting like something like that at the end of the day, mix that with one of those unsweetened, fruity, carbonated drinks like the LaCroix waters and those types of products. Make like a little wine spritzer where you're taking your 5 ounces of red or white wine and then making it more, and by adding those non-caloric fun beverages to it and making it a little lighter where it lasts a little longer. So that way you can still have a little bit, maybe infrequently, or carry that around at a party, so that you feel like you're getting to participate in the fun part of the celebration, but yet being mindful of your overall health. Let's talk about smoking. We think smoking would be implicated only in lung cancer, but smoking's actually implicated in quite a few different types of cancer, and breast cancer is one of those. So if that's an area you're struggling in, I hope that this discussion centered around this particular cancer would make you more energized and more determined to really work on reducing your nicotine intake with the goal of coming off of it completely. There are some people that can do that just cold turkey. They can just make their minds up and lay the cigarettes down and walk away and be fine. My mom actually quit that way. Many years ago when I was about junior high, she had a kind of a come to Jesus with herself, and she'd been smoking for, probably 20, 25, maybe 30 years. I'd have to sit down and put pencil to paper to remember exactly, but she literally stopped overnight. And I do have a very vivid memory of her picking me up from school with a box of pretzels on the seat next to her. So she exchanged a pack of cigarettes for a box of pretzels, but that was a temporary crutch that helped her kind of with that oral component of smoking. So I just want to encourage you to maybe set that goal for yourself. If you're currently using nicotine, that you say, you know what, that is one thing that I can definitely control and try to protect my body from being susceptible to cancer. The other thing is obesity, being overweight. This is not something that I think is regularly discussed, especially in a healthcare professional visit. We don't want to hurt your feelings. So we're all reticent to bring up the fact that perhaps, you're not at the most optimal weight. And having struggled with weight myself, I feel kind of bold to talk about patients because I was on that very journey myself. I had some, kind of destructive eating habits and some almost addiction, if you will, in that area. So I can share my own story with patients, and I even, have pictures to show my before and after. And this has been an 11-year journey for me now. But it's no secret that not being at an optimal weight makes us susceptible to all kinds of problems. And cancer is one of those. And so that is also something within our control. We can definitely control what we're eating, how much we're moving, and really making it our intention to get at and stay at an optimal weight. I know that there have been seasons in my life in these last 11 years where it's been very helpful for me to work with a trainer. It's been helpful for me to have a running group, where there's that friendship and camaraderie and even accountability, and that's helped keep me motivated. I'm kind of in a season right now of I'm doing fine by myself. So I'm really motivated to walk and to starting some jogging again. And so we just fluctuate. We're never staying the same. We're not stagnant. So find what you need, what will help you be consistent, because I feel like that's a huge key when we're talking about reaching an optimal weight, if that's an area that you're currently struggling in. And I'm so sympathetic to that. And I don't judge my patients, but I can be one that's going to bring that up and, kind of lay it on the table, and we're going to have a discussion about it, and we're going to try to get at the root causes, because there's lots of things going on that lead us to get to the point of not being at a healthy weight. But the studies are pretty good in showing that obesity is definitely a risk factor for cancer, and specifically breast cancer. So I want to encourage you to reach out to your friends, to your healthcare professional, and talk about it. Say, this is something that's of concern to me. Help me. And put together a plan that will work for you, where you're being nourished properly, with the right food, and that this is not for you to embrace a fasting, starvation mentality and begin to be afraid of food, because that's not where I want people to be. But I definitely want us being real transparent with each other that this is an important issue that we should be discussing and shouldn't just be ignoring it because we're afraid to hurt someone's feelings or even make them not want to come back into our office. And it can be brought up in such a way that I feel like my patient feels cared for and seen, but also we can be real honest with each other. And that has only come, when I've begun to establish a rapport with someone. So it's not, certainly don't whop them upside the head on the first visit, about all that. But it is part of our risk profile for breast cancer. Another thing is exercise. If you were to get on the internet and you were to Google exercise and breast cancer, you will see all kinds of studies that have been done. This is statistically significant in that the research time after time after time shows up to a 40% risk reduction in breast cancer simply by exercising a minimum of 150 minutes a week. That's pretty exciting. In any other instance in our life, if someone could offer me a 40% probability that something's going to be good, who of us would not jump at that? So again, this is all about intention, making yourself a priority, finding that whatever works, are you fine to do something on your own? Are you going to do better in a group setting, going to a class? When patients come to me, I have all kinds of friends and contacts in that whole exercise realm here in my area. So depending on where my patient lives, I'll often suggest, they connect with one of those types of groups for the purpose of receiving guidance and training and support. I think we all need that. So the exercise is huge. And if you set that goal at 150 minutes a week, and even if you were to say, I think, Lucy, I can do 30 minutes a day, then, that's 5 days a week. And then if you're like, no, I feel like I could do 45 minutes or even an hour. So that would then cut down, or you could plan for me this weekend, I'm going to be out of town. So I'm trying to get my hours in before Thursday, because that's when my week gets crazy. So I already know that. So I'm planning ahead. So in case I don't get my regular time, that I've met my minimum goal for the week. So that's just something that's important to me. And I know how much better I feel, just calmer, and like you can process the problems of the day, the world, when I'm outside and looking at the stars at night. There's just something pretty awesome about it. Also, another thing that's talked about when we're talking about risk reduction for breast cancer is breastfeeding. So for all the breastfeeding moms out there, good job. And also, isn't that amazing that something that you're already doing or have done has been shown to reduce risk for breast cancer? And that would also include maybe babies who are not put to breast, but babies that are receiving breast milk from moms who pump. So I would feel like there's still a huge benefit there for mom long term. So encouraging the women around you, daughters, when babies are born, to really think seriously about, can I breastfeed my child? And I know there can be obstacles to that. So, but just knowing that that's been looked at in studies, and I find that's kind of cool that actually has been shown to reduce our risk. The other thing is limiting our exposure to radiation and environmental pollutants. One thing I talk to women about is plastic exposure. I actually just had a conversation this morning with a new patient who came to me with the presence of an autoimmune disease. And so we talked at length about exposure to plastics. Plastics contain endocrine disrupting hormones or chemicals. And based on your unique genetic makeup, those things might be more obnoxious to your body than someone else's. So I just think in general, a general rule of thumb is to really decrease our overall exposure, and that you get one of those stainless steel or glass bottles that you can easily fill with, a good clean water, filtered water, and carry that with you throughout the day. Or if you're in a stationary position throughout the day, kind of like I am, I tend to be at my desk, during the work day, I have a gigantic 32-ounce Yeti, and so that I know how many ounces are in that, and then I strive to drink my appropriate quantity of water, but I'm doing that from that very clean stainless steel. And I do that at home. I also don't use those plastic containers very much anymore for food storage. I've pretty much switched over to Pyrex, to glass. And for the love of heaven, please don't heat leftovers up in plastic or styrofoam containers, and really start being mindful of that even for your children. There's those little marks on a lot of plastic items now that they're BPA free, and BPA stands for a big long chemical term that I cannot roll off my tongue at you for this at this very moment, but I think it's pretty well known that that's a bad thing, and we don't want BPA in like children's things. I know, like when my granddaughter was using a bottle, we were careful, no BPA, even her chew toys, things like that. So we want to overall just decrease our risk to plastic, because you have to stop and think. We're seeing so many weird things. The patient I saw today was a 16-year-old already with an autoimmune condition diagnosed at 13. I'm hearing more and more and seeing quite a bit in my practice, and you kind of have to ask yourself, where is this coming from? And I think that's a huge component. It is environmental toxins. Think about all of the products you use on your skin. Even consider perhaps moving away from a deodorant containing aluminum. Consider cleaning up the toothpaste products. There's so many things that we can do to decrease the toxic burden on our bodies. Because if you kind of look back over the last century and we look at cancer statistics, we didn't used to die of cancer back in the Little House on the Prairie days. That's not what was killing everyone. Probably accidents and infection then. And as we've become more modernized and we have all of these conveniences, there's some of that is a double-edged sword. So just being mindful that, you try to gradually convert your family away from plastics, and that you yourself are not just on the regular drinking out of plastic water bottles. I know sometimes that can't be helped. But being mindful of that and doing what you can just overall to decrease the toxic burden. Because most people in the health industry, or people that are in cancer research, I think most of us would agree that is a contributing component, and that we don't fully understand. We have a lot more understanding now of the behavior of our cell and what ultimately leads the cells to start behaving so crazy. But if we can strip everything away and get as clean as we possibly can, then I think we give our bodies overall, a better fighting chance at resisting that harm to us. So the other thing is, in prevention of breast cancer, I can't not talk to you about nutrition. I tell patients, where are all those dead people out there coming from? Just in general, from all causes. Is it too much broccoli? No. So, kind of being honest and saying, what is my nutritional status been, over weeks, months, and years, not just on an isolated day where you grabbed a drive-through meal. But what is that cumulative effect looking like? And what is the bulk of your diet regularly made up of? Is it fresh, whole foods? Or is your diet more regularly made up of processed, chemical-laden frankenfood? And we have to just be honest again about that, and how that over weeks, months, years contributes to a susceptibility to diseases in general, but certainly susceptibility to cancer. And when we're talking about breast cancer prevention, there's some very specific information we've learned that cruciferous vegetables happen to contain some very important chemical components that have been shown to be very positive to breast tissue. So lots of broccoli, lots of cauliflower, cabbage, kale, anything in the cruciferous family. Really be diligent about incorporating those foods into your diet on a regular basis. I tell my patients, eat as close to the dirt as you possibly can. Overall, I think that's a good strategy just for longevity and decreasing susceptibility to illness, disease, and cancer. I think that I'm going to do better in the long run if I'm eating a lot of fresh, whole foods, fruits and vegetables. And even the research is even highlighting in particular the Mediterranean style of eating, which if you were to look into that, the bottom of that Mediterranean kind of pyramid is going to be kind of whole grains, legumes, beans, things like that. So again, avoiding the super over processed grains, and it's kind of hard to get, in our modern society. You kind of have to be very savvy about knowing that, and knowing if you say you're a baker and you just enjoy that, where can you get your hands on various flours that are more going to contain the more whole, nutritious components of those plants, and incorporating that into your diet, but more beans, lentils, chickpeas, things like that. Because if we look at the blue zones around the world, those pockets of populations where we have seen a lot of centenarians or people living to over 100, those people, there are some similarities in those groups of people that it's this style of eating that seems overall to be a bit similar. And so olive oil in lieu of butter, and more fish in lieu of red meat. And I actually kind of counsel patients for breast and prostate health to really make red meat more of a treat. Like if you're just dying for a steak, then if you know you're going to go out to a nice restaurant, you let that be your treat. You have that nice filet, and then that's the last one you have for a while. Because those types of feedlot type beef, can have a lot of estrogenic activity. And so high estrogen and imbalanced hormones for men and women can be a risk factor for breast and prostate cancers, and commercial dairy products as well. So if someone is really looking at me and they're like, what do I need to do? I say I've got a strong family history of this, or I'm just overall wanting to be optimal, then we talk about little to no red meat and really not these commercial dairy products that you're finding in your stores, because those cows are not happy cows. And so you have to consider the end product and its quality. So your nutrition actually matters. And again, I know you might be listening to this video and say, but Lucy, so-and-so I know, I understand. There are always going to be the outliers who would have never done or had any of these risk factors yet still had breast cancer. And that's heartbreaking. But I'm still going to continue to say these things. I won't back up, put up, or shut up. This stuff matters. It matters what I eat. It matters how much radiation exposure I'm getting. It matters how much I exercise. It's going to speak to my long-term health and well-being. And I know that I can't guarantee my own self that I'm not going to have something unexpected happen, but I'm not going to stop doing these things because that's a possibility, if that makes sense. So in kind of concluding my thoughts in this talk about prevention of breast cancer, I mentioned the environmental pollutants and chemicals, and being more thoughtful about what you're bringing into your home and what you're using on your body. And then the other piece of that is decreasing your overall exposure to radiation. And in most places on the internet, if you were to go look that up and look at that in context of this discussion about decreasing risk for breast cancer, they'll mention medical imaging, such as, x-rays and CT scans. Those are probably the two most common that we are familiar with that contain radiation. But I find it interesting that they don't mention mammogram as something you should avoid because you're being exposed to radiation in that. Now, for this talk, I did not look up the dose of radiation in a mammogram. So feel free to do that and see how that compares to a chest x-ray or a CT scan. But how often does one typically have a CT scan? Some people might go their whole lives and never need that. I've had one, and I'm 58. I've had one CT scan in my whole life, but I've had a lot more mammograms than that. So in my next talk with you, I'm going to talk to you about perhaps an alternative to mammogram, certainly a supplement to mammogram for you to consider. And again, I'm never here saying, "Thus saith the Lord." Like, this is me just bringing information. And sometimes I'm talking to you personally about, something that I do or have done. And so I hope in thinking and honoring women that we know and love who have battled breast cancer or who may still be in that battle, that we all become more thoughtful of our health, and be thankful for how healthy that you are at this moment, and how can you maintain that, and how can you be less susceptible to disease and less susceptible to breast cancer in this month as we think about women who have struggled with this, and that we can, by our being more thoughtful about our health, I think that then honors the battle that those women have been in, because then we say to them, you know what, I'm not taking my health for granted, and I'm going to be more thoughtful and intentional, because I see what you've been through, and I honor that, and I respect that, and then I'm going to do my best to keep this body, going at its optimum. So thank you, and I want to talk to you in my next video about this complement or perhaps even an alternative to mammography. Thank you.